On WNYC. Now we'll look at some of the science behind the rivalry between Senator Rand Paul and Dr. Anthony Fauci that caused Fauci to repeatedly take the fifth, the invocation of his right not to incriminate himself at a Rand Paul-led Senate hearing last week. Here's how the White House, ever eager to show up someone they perceive as a political rival, even using the official White House website to do that, not a political one, posted a montage of some of those instances, complete with bed music and game show-style bells.
Well, nothing says honesty like taking the fifth, huh, Doc? What day of the week is it today?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
What color tie are you wearing?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
You get the idea. Now, here's 20 seconds of how Fauci explained why he was going to repeatedly take the fifth in his opening statement to Senator Paul's committee.
The only conclusion I can reach is that the sole reason he is calling me before this committee is to get me to say something, anything, that could vindicate his repeated public pledges that I end up, in his words, quote, behind bars.
So again, you get the idea. And the Trump administration, as we all know, has been on a campaign of retribution, trying to prosecute people or investigate people at least for evidence of criminality when those people are perceived as rivals. James Comey, John Bolton, Senator Alyssa Slotkin, New York State Attorney General Letitia James, Lisa Cook, and Jerome Powell from the Federal Reserve Board. I could go on. But what's the science that Paul and Fauci actually disagree on? And is it really science as opposed to a public health approach to public interest versus a libertarian one? Senator Paul is also a doctor, an ophthalmologist, if you didn't know, but also a political libertarian, which means the least government involvement of any political philosophy. Remember this libertarian moment from the first real month of the pandemic, March 2020, when people were first beginning to die in great numbers, when the lieutenant governor of Texas, Dan Patrick, basically suggested that people his age, he was about 70 and above, be willing to risk their lives and die in the interest of keeping businesses open.
No one reached out to me and said, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in.
Texas Lieutenant Governor Dan Patrick in March of 2020. With me now is Chelsea Cirruzzo, Washington correspondent for the Health Sciences and Health Policy news organization Stat News. Chelsea, always good to have you on. Welcome back to WNYC.
Yeah, thanks so much for having me again.
So one major issue between Paul and Fauci, just to dive right in, is whether it's been proven that COVID-19 came from a lab leak in China or some natural process of jumping from animals to humans, and whether Fauci was honest about that issue. You wrote last week, going into the hearing, that there is no proven link to the lab, and that Fauci has long said a lab leak cannot be ruled out. So what is the uncertainty based on today, more than 6 years after the start of the pandemic?
Yeah. So a lot of this stems from some recent so-called diary entries that Senator Paul released that Dr. Fauci had written in his, it seems as though his government computers about his experiences during the pandemic. In early 2020, there are entries where he is describing, questions about the origins of COVID. There is one particular entry where he says the Wuhan wet market, which is where a lot of scientists said that the virus originally appeared, was not the source of the outbreak, but an amplifier. Taken out of context, that might seem like, well, maybe he's saying that a lab leak is possible. Really what he was writing was that he believes that the virus had jumped from animals to humans at some point and had been amplified or spread further in the wet market. At the same time, he does describe meeting with scientists who are concerned about a potential lab leak. But of course, all of this was documented between January 2020 and March 2020. The science was emerging. He was literally writing as things were unfolding. So it wasn't clear. There weren't really any conclusions. But Senator Paul really has pulled from this to show that he believes that Dr. Fauci misled the public to hide that there is a potential lab leak.
And so a related underlying aspect of the debate is the whole idea of so-called gain-of-function research, whether it was involved in the origins of COVID or not. That would be in the Wuhan lab. Can you explain briefly what gain-of-function research is? Because I think listeners hear that term in connection with this and have no idea what that means. And if it's risky, why scientists or policymakers would take that risk?
Mm-hmm. Yeah, so gain of function is kind of tinkering with a genetic makeup of a virus to better understand how it evolves. And that's used in pandemic prevention work to better understand, as we saw with COVID, it seemed like every month it was evolving into a new version that we had to tackle separately. So the goal with gain of function is to kind of walk that back and figure out how a virus would evolve. It is, of course, a risky scientific endeavor. It is regulated by the government. Senator Paul has insisted that the federal government, the NIH, which Dr. Fauci was a part of, had funded this sort of research in Wuhan, which Dr. Fauci has denied and again has said they had regulated at the time.
You noted that as early as September 2020, before the first vaccine was rolled out, that Senator Paul argued at a Senate hearing that New York, and people who were here will remember just how many deaths were happening in New York. It was really an epicenter at the beginning. So as early as September 2020, when that was still the case, before the first vaccine was rolled out, that Senator Paul argued at a Senate hearing that New York had already hit herd immunity. Mm-hmm. What was the context for that you reminded of us of it in your article last week?
Mm-hmm. Yeah, so what he was talking about was that, enough people had gotten the disease at that point that we could return to regular life and there would be a sort of natural protection, not quite the protection needed for a vaccine. Of course, this was to the backdrop, and especially in New York, where this was highly politicized, highly discussed, to the backdrop of lockdowns, kids not going back to school, nursing homes especially were a big issue where people weren't able to see their loved ones in nursing homes. So Paul was really concerned that the actions taken by these states, which first of all, he believed Fauci had pressured or influenced them to do, were unnecessary and had contributed to this larger issue, social issue, people having their rights taken away, as he said, or people unable to, progress socially in school or to see loved ones.
Yeah, and in that context, I'm surprised, Chelsea, that the origins of COVID have been such a focus of the news coverage of the dispute between Senator Paul and Dr. Fauci, rather than Fauci's main work, which was directing the response to COVID. In a way, it doesn't matter how the virus started. It was an accident at worst, I think even Rand Paul would say, not a plot by China or anyone else to infect the world. So, of course, we should know what happened to help prevent a repeat, for sure, what the origins were. But the response was the main thing the public cared about one way or another for how it affected our lives. And there was such a backlash, beginning, we'll recall, with Trump, who was president at the time, and looking to get reelected on the strength of the economy, resistance by him to shutting down much of the economy to protect people's lives. And I guess that's also where the Dan Patrick quote comes in, as well as what you just described about Rand Paul's outrage at people not being able to visit their loved ones in nursing homes. Can you say if Rand Paul was also in that camp of, yes, let more senior citizens and other at-risk people die rather than inflict restrictions or economic pain?
I can't say specifically if that was what his view was. I think it comes back to this larger point that he was really hammering during this hearing, which was he felt as though Fauci's influence and his recommendations were based on this false premise. That being, he believes that he had hid that there was a lab leak. He believed, they point a lot to a interview Dr. Fauci gave in 2024, where he says the 6-foot guidance, social distancing, just kind of appeared out of nowhere, to basically argue that it wasn't science-based. Really, what he was saying was that it wasn't that 6 feet is the correct amount of distance we should be apart from each other. It was the distance that they chose, knowing that this was an airborne virus and we should be separate from one another. That said, it's not the perfect scientific distance that we had come to expect. So Paul, I think from his perspective, all of this was based on an overreach by the government to try to control the population, where he thought there could have been more discussion about the origins of COVID, perhaps a different approach when it comes to lockdowns.
Well, there could be one approach versus another approach as a legitimate policy disagreement. But Paul said at the hearing last week that, quote, the COVID lockdown could never have been inflicted without you, Fauci, aiding and abetting the crime. The crime. Was he suggesting that the lockdown policies were criminal? Since, of course, the whole context of Fauci taking the fifth is that he thought Rand Paul was looking for an excuse to indict him.
It's hard to say. I think that Paul has made it very clear that he wants to see Dr. Fauci indicted for something. I think it comes back to, like I said before, this feeling as though he misled the public and that he was hiding something. It remains to be seen if that can be tested in court. At this point, Paul is actually trying to hold a contempt vote for Fauci, contempt of Congress, tomorrow. Right. And again, it's unclear if that is even something that would work necessarily. So what he says this crime is, it's a little bit loose.
Yeah, that would be contempt of Congress if it goes forward for his repeated taking the fifth, which Paul would say is refusing to testify, despite the fact that he appeared to testify. Is there data, Chelsea, that can estimate how many more Americans than the 1.2 million that get cited who have died would likely have died without the early business and school closures?
Mm-hmm. Yeah, there is. And I don't have it quite in front of me right now. I can find it. But yes, and I think a lot of public health officials have said more people would have died if we had not imposed these lockdowns, these restrictions, and that, it was, of course, this issue of constitutional rights, which is what a lot of Republicans were arguing at this hearing, versus, the public health of everybody and protecting everybody. So yes, we do know that more people would have died had these restrictions not been imposed.
Is that a potential blind spot of public health professionals, though, to look too narrowly at the spread of a disease for the right policy response without considering enough the associated costs like learning loss and psychological damage for kids or other side effects, kind of social side effects like that?
Mm-hmm. Yeah, excuse me, I'm also losing my voice. I think that, when we talk about public health experts, their main concern is protecting from the virus spreading. They're not necessarily sociologists or policy people. And all of this stuff is supposed to work together to best, help everybody cope with what's going on. Certainly, and this was reflected in Fauci's diaries as well, or his writings, that when you're in this situation, you have to make tough decisions. And sometimes they're not the right decisions, or not the right decisions. They're not the best decisions. There's going to be fallout. I think that where we're at with these hearings and this sentiment towards Dr. Fauci and these feelings by Senator Paul is, why couldn't we find this middle ground? Was there opportunity for Dr. Fauci to maybe take a different path? And for Dr. Fauci, it was, well, this was the information that we had. Of course, hindsight's 2020. It's hard to look back and say we did everything right, and I think that's the problem, is we didn't. So I think Senator Paul's looking for someone to blame, and Dr. Fauci's trying to say that he, did what he had to do. It's not easy, and I think going forward, this is an important conversation because we do think there will be another pandemic one day, perhaps sooner than we think. So what lessons can we take away from this moment?
Here's Nick in Margaretville with, I think, some pushback on how the media is covering all of this. Nick, you're on WNYC. Thank you for calling in.
Hey, Brian. Thanks so much for taking my call. Love the show. I just find this the way the media is covering it, even your guest, everything is painted as though this is Rand Paul's opinion only. And where's the journalism to figure out? Because I've seen very convincing studies that there was NIH research doing what is gain-of-function research, and Fauci went on some very narrow definition to say, no, that wasn't gain-of-function, but it sounds like it was. And if it's a massive conflict of interest, if the person who is directing the response helped fund the research that potentially, according to all of our intelligence agencies say it is most likely a lab leak, and the way that it's like, oh, who can say what it was or what it wasn't? It's Rand Paul's perspective, and I want journalists to tell me what is likely here, and there seems to be a very knee-jerk response to defend Fauci, and the way he said, I am science. You're arguing with science itself if you argue with me. I think that is an extremely anti-science point of view, and this show and other shows shamed people, and people lost their jobs for contradicting the official scientific narrative, much of which has come into question. I just think there's an insane lack of curiosity and lack of self-reflection about how this was reported and what the narratives we were. I'm very pro-vaccine, I'm pro-science, but there was a lot of anti-science behavior going on, and I think people lost a ton of trust in the media and in scientific institutions, and that's painted as some Republican right-wing project, and anyone who's honest about this would never side with those evil Republicans, and there's been very little self-reflection. And I think we need to take a long look at ourselves in the mirror and say, if this was the result of a lab leak, that is a massive, massive story, and really should lead us to question some of these narratives that we've propagated. Thanks so much.
Nick, I really appreciate your perspective. I think what you were saying before, Chelsea, as someone who reports on this, is that they still don't know whether it was a lab leak or a naturally, a natural spreading from animals to humans, the origin of COVID-19 in people. Did I hear you correctly?
Yes. Yeah. And I appreciate the caller just now also saying that it's not just Rand Paul who holds that perspective that it was a lab leak. A lot of people do. Even the White House, if you look on covid.gov, they posit that COVID was a lab leak. So I think I appreciate that, because I think you're right there that many people have these same concerns. And it isn't just Senator Paul. But yes, I mean, in our reporting, there isn't, all of this evidence is not clear one way or the other. So I appreciate that.
And there was at least one cringeworthy contradiction to my eye between Fauci's diary, now made public, and how they're quoting his public statement from him, what he said in public. He wrote in the diary that he helped convince Mayor de Blasio in New York and Governor Newsom in California at the very beginning of the pandemic that lockdowns, including school closures, were necessary. Says that in the diary, helped to convince them. But then they cite a quote in public, the Rand Paul and other forces who want to vilify Fauci, when he said, he never shut a school. I never shut a school. I never locked down a business. Do you have a take on that? Like, he wasn't the official at the local level making those decisions, but according to his diary, he was pushing for it.
Yeah, I definitely heard that as well. I think if we're talking about narrow definitions, it's not like Dr. Fauci went to a school and said, close this school, but he was the top infectious disease expert in the country. So if he was saying close the schools, then the states were going to do it. So you're right there. I mean, he was saying, well, I didn't tell the states what to do. You can only imagine that those states were seeing what he was recommending and then going off of his recommendations. So yes, he did certainly influence those policy decisions.
And, there's to that point and to Nick's call, there's an op-ed in the New York Post today that's both anti-Fauci and anti-RFK Jr., but blames Fauci in part for the rise of RFK. It says Fauci, quote, relentlessly pushed destructive lockdowns and pointless masks, priming the public for a rejection of the much more efficacious vaccines to come. So this particular writer in the Post, pro the effectiveness of vaccines, anti-RFK, as being whatever we want to call RFK, but blaming Fauci in part for the rise of RFK because Fauci did things that led people to trust public health less. That's one writer's opinion. On the premise that the masks were pointless from that New York Post quote, what does the best science say today about that 6 years later?
Well, from my understanding, it's that it was an airborne disease. So having a face mask can prevent at least some transmission. I remember reporting on this back in 2021, and it got so granular. And do you wear an N95? Do you wear a cloth mask? Do you do this? Do you do that? I think that possibly is part of the confusion here. It's hard to say one way or the other. Sure, N95, a respirator, all those things can do better, can help you more. But just covering your mouth, it's like when you cough, you shouldn't cough out in front of people. So I believe the masks, from what our understanding, they did help. Was that overstated or understated? It's hard to say because, again, people were using different masks. But I did want to go back to the op-ed you just said.
And by the way, Fauci was on with me near the beginning of the pandemic, and I was trying to get a handle on, well, what kind of mask really works here? Can you use sort of a regular, what they call surgical mask, those pretty thin blue masks, or does it need to be an N95, KN95? And he said, the best mask to wear is a mask that you will wear. Mm-hmm. And I think we've heard things like that about other public health issues too, right? Trying not to scare people off from using something at all if they don't think they have the ultimate one. And so he said the best mask to wear is the mask you have and the mask you'll actually use. So I don't know if that kind of thing was confusing people and led to loss of trust too. But what did you want to say about the op-ed?
I mean, I think that's part of it as well. It's, we're being told, trust the science, trust the experts. But the truth is we're learning as we go, right? So, wear a mask, but which mask do I wear? Which is the best one? What does the science say? It's not that simple. And I think where that contradiction was, like, especially with that op-ed, was that, the science was progressing as fast as the virus was. So there wasn't, here's this one study that says, for sure, this mask is going to help you. For sure, this thing is going to help you. We were making our best, or at least as the public health experts said, they were making their best decisions based on the information they had, and that information evolved. So I think as the pandemic progressed, I remember, hearing things early on, I should wipe down my groceries. Later, that's not the case. It does contribute to that sense of, well, who do I believe? Why would they tell me to do that if that's not what I should be doing? And I think it's just hard to, if you're not a scientist, to understand, and I'm not one, so it's hard for me as well, that this stuff changes. Science is not always exact. But that's really difficult when your loved ones are sick and they're dying, right? Like, you can't wait for science to be exact.
Here's a call who kind of the opposite of the op-ed, I think, blames Fauci for not being specific enough about what kind of masks were necessary. Merrill in Brooklyn, you're on WNYC. Hi.
Hi, it's Larry. But is that I am a scientist? Is that the allegations by Ron Paul are smoke and mirrors? They're not true. But what is true, and what Fauci is responsible, is the deaths of the nurses. because if you take a look at percentage-wise, the nurses died, and they were wearing masks. They were wearing those useless blue masks, which he recommended, and he knew that they were useless and covered it up because the only place that was producing them was China, which hoarded them because they wanted to protect their population, understandably, and the United States did not have the masks. It's like going to World War II without any bullets. So if you take a look at the proportion of nurses that were killed, died, is that he is totally responsible. And he repeatedly, with that idiotic comment, which you accurately reported, that it's better to have a mask that
will
works.
wear. But I'm not. I mean, I would have to fact check what you're saying.
That's not science.
But Meryl, with respect to
what works.
I understand. But with respect to nurses in hospitals in particular, I mean, doctors and nurses in hospitals wear masks routinely because there are a lot of infections in the air. So
Right.
wouldn't whatever standard they were using in hospitals before COVID have applied to COVID as well? Where what Fauci was saying on this show, that was more for the general public who never thought about masks before.
Unfortunately, not, because COVID, because of the nature of the virus, is that, and being much smaller, so it could overwhelm the blue masks, which
Yes.
which really were
More transmissible,
effective.
you're saying, than
The
other
proof is
things
that-
nurses
and the-
typically
and the
encounter.
proof- Right, is that the proof is that they had a much higher rate. They wore masks. So one is that it really did cause the RFK problem because people don't believe science anymore, because Fauci was the voice of science, and he kept changing the nature of what the mask is. And the reporter there actually was correct, is that they would change the definition of what a mask is. So yes, the blue mask didn't work, but the N95, and my patients wore them. No one is that they didn't need the vaccine, and none of them got sick, and I didn't get sick because I wore the mask.
Meryl, I'm going to leave it there. Thank you very much. And of course, when we're talking about nurses, there are other factors as well. They're exposed up close to so many people with high viral loads. But an interesting point, and more evidence, Chelsea, of how people from various perspectives lost trust in some of the things that Anthony Fauci was saying, and how that might have generalized to losing trust in public health officials and what they say in general. So last question. Mm-hmm. If COVID came the same way today, knowing everything we know now, is there a public health community consensus that things should have been done differently or pretty much the same?
I would say, from my understanding, my reporting, it feels like the same, right? I mean, we have so much different perspective on how to handle a pandemic. And I hope I don't see another one in my lifetime, but there's no clear understanding of what to do. I don't know how that historically has panned out. But I know, at least from COVID, there was a lot of dissatisfaction with what happened. And whether I don't think we've reached a place, and as you can tell from the hearing yesterday, I don't think we've reached a place, last week, that we have a consensus on what should be done differently. Even Dr. Fauci, I think that he has said, some things were not perfect, but he hasn't outright said, and of course he pled the fifth, that I would do X, Y, and Z differently, so there's no clear consensus there.
Chelsea Cirruzzo, Washington correspondent for Stat News. We always appreciate when you come on with us. Thanks a lot.
Thank you. I appreciate it.